Have you ever pondered the efficacy of shockwave therapy for erectile dysfunction? Is it a genuine cure or merely an unproven treatment? Well, today we delve into this intriguing topic, discussing the effectiveness, safety, and ongoing debates surrounding this novel therapeutic approach. Low-intensity extracorporeal shockwave therapy, despite its mouthful of a name, has piqued the interest of many in the medical field. According to some urologists, it's a safe treatment for men with erectile dysfunction and might improve, or even cure, this condition in certain patients. However, they also caution that there are crucial unanswered questions, such as identifying the ideal candidates and determining the best protocols and devices. The lack of clear answers makes the use of this treatment outside research settings a contentious issue. Research on shockwave therapy's application in Peyronie's disease, a condition causing penile curvature, has shown potential for reducing penile pain, although it seems less effective in rectifying curvature. The greatest benefit of this therapy could be for men with erectile dysfunction. Dr. Georgios Hatzichristodoulou, Associate Professor of Urology at the Julius Maximilians University of Würzburg in Germany, has conducted several European studies on this subject. He attests that the studies carried out in the last 6 years are promising, especially for vasculogenic erectile dysfunction. The European Association of Urology even recommends low-intensity shockwave treatment for patients with mild organic erectile dysfunction or those who respond poorly to phosphodiesterase type 5 (PDE5) inhibitors. Output. Nonetheless, the effectiveness and credibility of this therapy for erectile dysfunction has faced criticism. Dr. Hatzichristodoulou states that many studies weren't well designed and had varying treatment protocols, shockwave devices, patient inclusion and exclusion criteria, and even different study endpoints. This diversity makes it challenging to draw conclusions for the general population suffering from erectile dysfunction. Despite these uncertainties, some providers in Europe and elsewhere are promoting this treatment and charging patients for it, claiming it should be the new standard of care. Yet, according to the available literature, we cannot categorically endorse this claim. There are still important unanswered questions. Studies suggest men with vasculogenic ED are likely the most ideal candidates for shockwave therapy. However, it's unclear if they are the only ones. The perfect protocol for delivering therapy also remains elusive. How many sessions do patients need? How many shockwaves? What energy level is optimal for treating erectile dysfunction? And with a plethora of devices on the market, which one is the best for each patient? In the United States, FDA approval for a low-density extracorporeal shockwave device to treat ED might still be years away, according to Dr. Ranjith Ramasamy, Assistant Professor of Urology and Director of Male Reproductive Medicine and Surgery at the University of Miami. In summary, while shockwave therapy presents promising potential for treating erectile dysfunction, it's clear that more research is needed to validate its effectiveness and safety, to determine the ideal candidate profile, and to establish the most effective treatment protocol. The journey to fully embracing this treatment is far from over, but each step taken is a stride towards a possible new avenue for managing erectile dysfunction.